Hello, viewers. Welcome to your favorite midweek show, Let's Talk About. Let's Talk About is a real understanding of social issues that borders us as Christians. You are welcome to this week's edition. To have this discussion with us today, we have been joined by Dr. Ira Ajua Ahima Nuno. She's a public health physician at Douala Medical Center, Bema Camp. I am Kojo Apia, your host for today. Let me remind you, viewers, that we are live on our social media handles, YouTube as Trinity United Church Legon and Facebook Trinity United Church Legon. You can send your comments on our social media platforms or via our WhatsApp number 0501 579 996 0501 579 996. You are welcome, Doctor.
Thank you.
Please, can you give us an overview of breast cancer?
Okay, so when we say breast cancer, just an abnormal growth of breast tissue, okay, in both men and women, because men also have the breast tissue. Usually when cells grow and then they multiply and divide, they have to go at a particular rate and then stop growing. But with breast cancer cells, the cells are growing at an abnormal rates than usual, okay, so they tend to rapidly grow. In women, if we pick, maybe there are 8 women in a room and you take one out of the 8 women, she's likely to get breast cancer. But with the men, if we take one out of 100, he is more likely to get breast cancer. So you can see that it's more common in women than in men, okay? And women is the second most common cancer that they get. And it's quite, it affects us globally, okay? It's quite a large scale. In about 2 years ago, we recorded about 5,000 breast cancer cases in Ghana, and half of these actually died because of the late reporting. People are not screening like they should. Okay, so the late screening results in a late presentation. By the time they come to us, it's spread beyond a certain stage, and then we have to. They end up not surviving. But ideally, if breast cancer is detected early, you can actually survive and then come out all right.
All right. So, Doctor, to ask, you said people don't test early.
Yeah.
So, is it that they are scared?
Sometimes it can be the educational level or not being aware that even something like this actually exists. Others too, yes, it may be because of fear. Others too, they don't have the means, okay? So they don't have access to possibly mammograms or ultrasound scans. Some don't even know how to examine their breast as well. So it's various factors that play a role when it comes to women screening their breast. It's not a one size or fits all approach. It depends on every woman. But what we've realized is that women that have a higher educational level tend to often screen their breast than those who don't have so much of an educational level.
All right. And also to ask, what is the Ghana Health Service doing about these things? Are they making provisions for such situations? Are they going to the villages, the rural areas to educate people on that?
Okay. So I can't speak specifically for Ghana Health Service, but at least I know that we've improved our education very well when it comes to breast cancer. It wasn't like this in the past. Now you go everywhere, I've seen the Pink October ribbons. You know, you can see banners with Pink October. Yes. Offices are, so it's, the awareness has generally increased over time, and so has the education as well, okay? We may not get to everywhere, but at least through mass media, through television, through radio, through a lot of advocacy channels, by going to marketplaces, schools, churches, etc. At least we are making some impact over there in educating women on breast cancer.
Wow, I'm loving how the conversation is going, and I'm sure our viewers will also love it.
Yes.
Please, if you just joined, we are talking about breast cancer awareness, and if you have any questions as Doctor goes on, kindly send your comments to our Facebook page and also our YouTube channel as well. So from here, we'll be proceeding with Doctor's presentation, and I am eager to learn more today. So, Doctor, please, can you proceed with your presentation today?
Okay. So ideally, every woman, when you get to 20 years onwards, you should be examining your breast for breast cancer, okay? You can do it once and every 3 years for, as in a health professional to examine it for you once in every 3 years. But you, the woman, every month, you need to have it examined. The best time that we usually do the examination is just after your period, okay? That's the best time we do the examination. And we advise women who are age 40 years and above to, besides just doing the breast examination by themselves, also to do a mammogram in addition to the examination. Because mammograms can pick up certain things that the examination of the fingers may miss, okay? So if you're a woman and you're over 40 years and above, ideally you have to do the mammogram in addition as well. How often you do the mammogram depends on your risk factors or your family history of breast cancer. So that depends on what your GP will tell you. Some have to do an annual mammogram. Others can do mammograms every 2 to 3 years. Others every 2 to 5 years. So it all depends on you, the woman, what risk factors that you have, whether you have a positive family history or not. Do you have very strong genes for it? That will determine how often you, the woman will do the mammogram. Okay. So after age 20, every woman does the screening. When you get to 40, do the mammogram. But with the menopausal women who don't have any, obviously they're not bleeding, so they cannot have their periods. They can just pick a day within a particular month. So let's say your birthday is 23rd October. So the 23rd of every month, you examine your breast. Okay, so you don't have a period like the other women that are bleeding that can use that cycle to guide them. So you can just pick any day in the month and make sure that every month, if you're a postmenopausal woman, you're examining the breast yourself. And then when you're age 40 and above, they will do the mammogram. If you're less than 40, you do the breast ultrasound scan. And I must say that usually when you see a lump in the breast, don't always think that it's cancerous. Most of the time it's even non-cancerous, or what we call benign, okay? So sometimes when you're examining your breast, you may see a lump, but it's not a cancerous one, all right? So don't always think that it's cancerous. Make sure you go to the hospital for a further checkup. Let us also do our checks. Let's confirm with the scan or the mammogram, depending on your age limit. And they will be the ones to make the diagnosis for you that indeed it is breast cancer or it's not. Because you can find lumps in your breast, but they are not cancerous.
So please, I wanted to find out if there are different types of breast cancer, and if there are any, kindly let us know.
We have more of stages of breast cancer, depending on when it is picked and which area is affected. Usually, it's a bit technical, but within the first 2 stages, we say that it's curable in quotes, or it's treatable. When it goes to 3, stage 4, especially with stage 4, where it has spread to other parts of the body, like the other organs, it's a bit challenging to treat it. And with stage 3 too, it spreads beyond where the breast tissue is. It's not localized, so it's like deep within the chest and all that. It's also a bit difficult to manage. But with the stage 1, stage 2, when it's just limited to the breast, now you can either just do the lumpectomy or the mastectomy, where you remove the breast and then you should be okay, you should be fine. So there are more of stages than types per se.
Okay. So before coming, I read about breast cancer, and I learned that it also spreads to the brain when it gets to the 3rd or 4th stage. So I wanted to find out, I was a bit confused, so I want to find out if it leads to mental disorder or it have a deadly effect on the brain. So.
Okay. When it comes to the spread of the cells, cancer cells to the brain, what it can do to you is rather cause some strokes. So you realize that the person may be paralyzed in one side of the body, or the person may not be able to speak or communicate with you effectively. The person cannot. Because you need your brain for speech, for movement, for eating. The brain does a lot of coordination and all that. So you realize that you lose all those senses. Even your thinking and all that comes down. Yeah, so it's more of the cognitive function declines, or it's reduced. Okay, so that's how come the brain gets affected. But when we go deeper into, when we start talking about the self-care and all those other issues, you realize that also mental health disorders come in, like depression, anxiety, etc. Actually, when they start going through the treatment, it has quite a daunting role on the body. So you realize that they struggle to go through with it. So those are the ways in which the brain can be affected.
Okay. So moving on to my next question, I would want to know how family history impacts breast cancer.
Okay. So with the family history, there are some breast cancer genes that if you have the breast cancer gene 1 and 2, or the BRCA 1 and 2, when you have those as part of your genetic build-up, okay, you are more likely to have breast cancer and even ovarian cancer as well. So those are linked to those particular genes. So you realize that some people, they have a very strong family history because they have those genes. So let's say the grandmother may have breast cancer, the auntie may have it, their mother may have it, the sister would have it. You know, is that strong? So some of them would even opt for a prophylactic mastectomy. They'll just say, please, doctor, come and just take the breast off of me because I just don't want to have them there anymore. Because you know what's coming ahead, you know. So some have very, very strong genes. We don't have the means of checking whether you have those genes currently here in Ghana at the moment. But outside, they can do the check for you to be sure whether you have the genes or not. And then you decide how you plan your life accordingly, whether you still want to keep your breast or you want them to be moved prophylactically.
Wow, it's getting interesting.
Yeah.
Doctor, please, can you continue your presentation for us?
Sure. So the symptoms and signs of breast cancer. How do you know that you have breast cancer? Okay, the most common one is the breast lump. So that's what most women would feel and actually report to us that they can feel something in their breast. Also, we have what we call dimpled or depressed skin, where just the way you have a dimple in your cheek, you have a dimple as well in the breast. Some pictures will show afterwards, so you'll see all those things. Also, your breast can be swollen. Either one or even the two of them can be swollen, okay? And then you can have nipple changes. So ideally, your nipple should point outwards. But in breast cancer, the nipple points inwards or it flattens down. Okay, so that's abnormal. If you see that, it's not a normal thing. But I'll just put in here that some women are actually born with nipples that go inwards like that. So if you are born like that, your breast like that, nothing to worry about. But if your nipples were pointing outwards and they start to go inside, then you have to get worried, okay? And then usually breast cancer is painless. But then when it starts to spread, when it goes to the stage 3, stage 4, you start to feel pain. Okay, so some may come complaining of breast pain. Others too, they have a lot of skin changes. Either your skin is colorless or it's not the color that it should be, okay? Or the texture changes, what we call the orange peel or the peeled orange appearance of the breast. You can also have bloody nipple discharge. So if you're a woman, ideally nothing should come out of the nipples at all. No discharge should come out. But when you start seeing blood coming out, maybe it comes in your bra or when you're bathing, you're done it, or your towel or something, it should raise a few alarms for you that something is wrong somewhere. And also, some may have ulcers on their breast or sores on the breast, okay? So if you see any of these symptoms or signs, please, you have to report it to the hospital. Don't keep it within yourself. It's not the best. And then when it spreads, it's really in the stage 4, when it's gone to other parts of the body, the organs can also be affected. So it can go to the liver and cause jaundice, which is a yellowing of the skin and the eyes, okay? You can have bone pain when it spreads to the spine. So you see that they have to have them pain, back pain, they have knee pain, you know, they have those joints pain because it has spread to the bone. You can also have dark urine. When it spreads to the liver, dark urine or pale stools. You can have strokes if it spreads to the brain. And when it spreads to the lungs, you have difficulty in breathing, okay? So those are a few things that when you experience, you know that, okay, definitely it has gone beyond where the breast is, it has gone to other parts or other organs. So this picture just just a pictorial view that just shows you exactly what we've spoken about. You know, like what to look out for, the nipple change, the nipple discharge, the skin changes, the shape of your breast and all that. So as a woman, you should know what your normal breast looks like. So that if any abnormal finding comes, you can pick it up quite easily, okay? So know how your breast looks like, know the size of your breast, know the shape of your breast, know how everything looks like on your breast. So that if there's anything abnormal, you can easily pick it up. So this also summarizes exactly what I've gone through earlier, just so that at least, you know, when people see things in pictures, it makes things a bit clearer for them. So I just put that in just to guide you. Come on to the next slide. So I put this one here to teach people how to do a breast self-exam, you know, because I realize that most people don't know how to do it. But since we don't have anybody to do it, it might be very hard for me to show, but I'll just, maybe those at home, whilst they're watching, they can be doing it by themselves or something, you know. What you can do first is stand in front of a mirror and then just look at how your breast looks like. You can raise both your hands up. You can hold your waist to just tense it up a bit, okay, afterwards. And then you just examine your breast. You just use the 3 flat parts of your fingers, and you go around in a circular motion. So the easiest technique is actually you can divide the breast into 4 parts. So you draw the imaginary line to your nipple like a cross. So you get 4 different areas. Okay. Then you just use the 3 fingers to just go around all of them. When you're done, you squeeze the nipple to just see whether any fluid will come out. It's a very, very simple technique. It's not so difficult to do. Okay. Usually because you are doing one breast after the other, you have to at least be comfortable. So you can even lie down and just put one hand behind you, examine the breast. Now if you just swap with the other hand and all that. Okay, so it's, but the more you practice, the easier it is for you to do. Okay, so at least if you put in your mind that every month I'm going to be doing this, you realize that you become a pro at examining your own breast and you're able to just flow with it. So this is just exactly what I've said, just that it's in the word form. So those at home can be practicing how to do it. The pictures also show you or they guide you as to how to go on in that circular motion around the breast, just to examine the breast effectively. Then you just squeeze the nipples and see whether any fluid comes out. So you can see the lady squeezing the nipples at the bottom picture. Okay, yeah, this one. So you're squeezing the nipples to see the fluid that is going to come out, okay? So it's like at least between 3-5 minutes, it should be done, or even less. It's not a procedure that keeps so long, okay? And I'd encourage every woman out there, at least every month, just after your period, please just be checking from time to time. So we have, because breast cancer has no particular cause, it's a complex something, okay? So it doesn't have any particular cause, like the way you can say mosquito would bite you and cause malaria. This one, it has more what we call risk factors, or things that you may be exposed to that may cause breast cancer. It doesn't mean that if you have any of these things, you get it. And some people don't even have a single one risk factor, but they end up getting it. So that's how complex breast cancer is. But we still put it in there because of science, just for you people to know. So the first risk factor is obesity, okay? When you're overweight or you're heavier than you should be, if you have a BMI of more than 30, okay, it means you're obese. So you have a higher chance of getting breast cancer. Also, those who don't exercise, those who like to abuse oral contraceptive pills, those who don't breastfeed. So let's say you are pregnant, you have a baby, but you're not breastfeeding the baby. Okay. It can increase your risk of having breast cancer. Also, women who had their menses at an early age. So let's say you had your menses around age 9, instead of maybe by 12, 13, by age 9, 8, 10, you're having your menses. Reason being, you are being exposed to the hormones, estrogen, that helps or facilitates the growth of breast cancer cells, okay? So what we call early menarche, where you have your periods quite early, or late menopause. So some people have menopause after age 50, 55, instead of like 45, 46 there. You're exposed to the hormones that would help with the growth of the breast cancer cells. So you have a higher chance of getting breast cancer. Also, women that have, they delayed in having their children. So they had children after age 35 years old. Okay, those have a higher risk of having breast cancer later on in life. And I've talked about the abuse of contraceptive pills already. Yes. Those have a positive family history. Like I said, if you have a very tight family line, so grandmother had it, mother had it, auntie had it, that definitely this thing runs in the family. You have to be very, very careful, okay? And then having a previous breast lump as well, and then being exposed to radiation. And then we have something that we call hormonal replacement therapy for menopausal women, especially when they're having the hot flashes. Sometimes we put them on this hormonal therapy to help them. But that can also increase their chance of having breast cancer later on in life. And then the genes I've spoken about, the breast cancer genes 1 and 2, okay? So these are a few things that would increase your risk of having breast cancer, okay?
So,
next slide.
Before you started with the risk factors, you made mention that there's no particular cause when it comes to breast cancer. And I have a friend whose mom is having breast cancer, and when she called to talk to me about it, she first said it's spiritual, so we need to pray. And I was a bit confused. So I want to ask, is there any sort of spiritual backing if someone gets breast cancer, or can we say that, this person has been cursed with breast cancer?
I like this question because most people, when you diagnose them of breast cancer, the first thing to think about is that it's a death sentence, or somebody has cursed but did something wrong or something. But like any other disease, it has no spiritual component to it. It just happens by chance or by science. I mean, most people would go pray. Prayer works, and I always say you should pray alongside whatever the doctor is guiding you to do. You know, I don't dispute that. But don't focus so much. Some people just go to prayer camps and abandon what the doctors are telling them, and they'll come back and it's even the breast like ulcerated and it's smelling and it just looks bad. It's even worse than it was before. You know, so I'll not encourage people to. I mean, don't ignore your spiritual side and say I'm not gonna pray. No, you can pray, but don't also ignore what the doctors are also telling you. You can do it alongside. It should be like a dual something. So you are praying alongside doing the orthodox medicine, and the two come together and it works. But it's definitely not a spiritual illness or anything. No, it's nothing like that. It's not spiritual in any way.
Okay, so I also want to ask, what skincare routine will you recommend to people? You know, some believe that there are some skincare routines that causes breast cancer. If it's true, kindly let us know. And if there are some skincare routines that one can do to curb that, kindly let us know as well.
Okay, so no research has actually shown that there's any skincare routine that can cause breast cancer from what we've gone through our research. Okay, but what I'll say rather is like those who have rather been through the treatment, you know, because you lose your hair, you know, the chemo, you end up losing your hair, you know, your skin looks bad and all that, you know. What you can just do is just to make sure you're eating healthily, okay? So at least more fruits, more vegetables, drinking enough water, and then making sure that your skin is moisturized, all right? But skincare routines do not cause breast cancer per se, okay?
Okay. And please, I also want to ask, does excessive abortions also cause breast cancer? You know, we have people who have done abortion not once, not twice. And does it also cause breast cancer? Because you talked about breastfeeding, and when one gets pregnant, you know, the breast begins to get some water in it for breastfeeding when the person delivers. So if the person does an abortion, does it increase the person's risk of getting breast cancer?
No, it doesn't. I mean, having abortions has its own challenges that come with it, but it's not linked to breast cancer per se. Okay, there's no direct link that if you do abortions, you know, you get breast cancer. However, those who tend to abuse those oral contraceptive pills, especially the emergency contraceptive pills, let me specify, I don't want to mention their names, but we all know what they've been doing. You know, some people will not use proper family planning and they'll be using the emergency pills. And they'll drink as if they're drinking water. So they're using it, the following they're using it again. And when you keep abusing the emergency pills like that, the contraceptive pills like that, that would increase the chance of having breast cancer. Okay, but not necessarily having or performing an abortion, no. But I'd encourage women that can breastfeed their babies to actually breastfeed. And that is why that myth comes. A lot of people say that when men suck the woman's nipple, she's taking away the breast cancer cells.
I actually wanted to ask that. I actually wanted to ask that.
Yeah, that's where that myth came from, you know. But it's only that it's the breastfeeding process, the milk production from mother to baby. That's actually a protective factor. Not necessarily the man breastfeeding from the woman's nipple or something. No.
No, okay.
Yeah.
So,
So the men should stop putting that idea out there that when you suck the woman's breast, you are being helpful in any way. No, I mean, if it's for your own pleasurable activity, that's your own cup of tea. But I mean, it has nothing scientifically to do with breast cancer in any way.
all right. Okay. Doc, also to ask, how can one cope with hair loss and then changing weight?
Okay. So what you can do is, you know, those things are about to happen. I mean, those are the side effects of having to go through chemotherapy, because it's breaking down all the growth cells, and definitely things like hair, nails, skin, they grow quite rapidly. Okay, so by all means, you end up also losing or damaging them in the interim whilst you're trying to destroy the cancer cells. For a woman, usually we can do with our wigs. You know, so you can put a wig on your hair just to make it look good. Or you can even decide to go bald. You can look bald, and I think you can still look good in the bald, depending on how you bring yourself out. I mean, if you do yourself bald and you wear some big hooped earrings, You think it's some swag that has even come. Someone would want to even copy your fashion style or fashion sense. So it all depends on how you make it, or how you if a positive way of thinking, it's easier for you to adjust to these side effects, okay, and how to take care of yourself. So things like wearing wigs, you know, especially when you lose your breast, you can even wear padded bras if you don't want to get an implant and all those ones inside. So the self-care, it all depends on the woman and what you want to do to make yourself feel good. Okay, there are a lot of options there, you know, but you can decide which one that you. I mean, it's not a one-size-fits-all approach. It's tailored for every particular person, depending on what you want to do. If you want to rock the bald, you rock the bald. If you want to wear a wig, now there are different kinds of wigs, so you can also rock that one as well. Okay, so those are a few things you can do for the hair, and then with the skin care and the nail care, those ones take a while to recover. So now you can't force that, you know. But eventually, it all comes back. Once you stop the chemo, everything goes back in the normal way. Your hair will start growing again. Your skin will be back on point.
So, Doctor, I remember some time ago I used a certain deodorant, and then a few weeks later I realized that there was this lump in my armpit and some rashes. So, talking about breast cancer and lump, you know, breast cancer goes with lumps. So, I want to ask,
Okay.
does using Sure or deodorants cause breast cancer?
Okay. So deodorants or antiperspirants do not cause breast cancer. It's also a common myth that is out there. And some people may react to antiperspirants when they use them. Okay. They may have some allergic reaction to them. That may cause the lump and the bumps. But deodorants do not cause breast cancer in any way. It's not linked in any way to breast cancer.
Thank you very much, Doc.
Yeah, welcome.
It's getting interesting, and I'm loving the conversations as well. And I'm learning a lot.
I'm glad you are.
I'm learning a lot. So, viewers, we will go for a short break, but let me remind viewers that we are streaming live on Facebook and YouTube. The account name is Trinity United Church. So, if you just joined, you can like and share to your friends as well. And if you have any questions or comments, kindly send them to the comment section. Or you can also send your questions and comments to our WhatsApp platform on 050-157-996. 050-157-996. Thanks very much.
With the growing challenges of global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians.
Welcome back, viewers. We are having an interesting conversation. Still with us is Dr. Irajua Ahima Nuno. She is a public health physician at Douala Medical Center, Bema Camp. We are still talking about breast cancer. I am Kojo Osayapia, your host. Doc, you spoke about risk factors and some likely causes of breast cancer. Can you talk to us, or can you tell us about some preventive factors or measures to put down in order not to get breast cancer?
Okay, so as usual with alcohol and smoking, come on away from them. Okay, they're everywhere. You have to avoid them totally, please. No smoking, no alcohol. You should also lead a very healthy lifestyle. So you're eating more of your fruits, more of your vegetables, you're drinking enough water in a day, you're exercising, very, very important. So the key thing is if you lead a healthy lifestyle, you're able to have an optimum weight. Okay, so you don't gain enough weight to make you get the breast cancer. So you're eating healthily, you're not smoking, you're not drinking, and then you are breastfeeding as well for the mothers who can actually breastfeed. Some women generally have some challenges, so if you can't breastfeed, it shouldn't be a problem. But for those who can breastfeed, please make sure you're breastfeeding your baby, okay? And then also the regular or the monthly examinations are very, very important. Most women don't do them. But the more you know your breast, the more it is, or the more easily it is for you to actually pick up any abnormal finding. So I'd encourage every single woman that's listening, and every single man that's listening, because men also get breast cancer, that they should always do the regular monthly self-examination by themselves. And then take the chance. During the Pink October time, you can have a professional do it for you. Most people do a lot of free screenings during this period. You can just walk in and then they just do the free screening for you.
All right. So, doctor, earlier on you made mention of radiation and chemotherapy. So I want to find out, are there any side effects when it comes to chemotherapy, radiation treatment?
The radiation was for exposure to radiation was a risk factor. Okay, but the treatment regime for breast cancer is radiotherapy. That's different from the radiation that I mentioned earlier, yes. So with the treatment modalities, either we are removing the breast or the lump. So with the lump, it's called a lumpectomy. With the breast, it's called a mastectomy. Okay, it can either be one single or double mastectomy, depending on which breast, whether one or two breasts are affected. So either you are dealing with the cancer through a surgical means, or you are doing chemotherapy, or you are doing radiotherapy. The reason why we add these additional ones, the radiotherapy and the chemotherapy, is because we want to destroy or kill any other cells that may be present after we've taken the breast off. Because we can cut the breast off, but maybe we have made some deposits or something. So when we do the chemo and then the radiotherapy, we destroy all the cells in there. And the radiotherapy that you are getting, the rays, they are not so harmful to you. They don't cause breast cancer in any way. So just because I'm giving you radiotherapy to destroy breast cancer in one breast doesn't mean that it will end up creating an aftermath and then destroying the other breast in any way. No, it's not done that way. The radiotherapy, the rays are quite safe. Okay, so the radiation doesn't affect the breast like that. Yes, it's not so bad. And then we have the palliative care, where it has spread beyond, like I said, it's it's gone beyond where we can actually treat it. Okay, it's no longer curable in quotes. We can't really cure it. You have a period that you can live for a while, you can survive, and then later you have to go. So we'll just make that journey a bit less painful for you. That's what we call palliative care. So we are giving you painkillers like the morphine and those strong things. Because breast cancer is very, very painful when it spreads. In the stage 4 is terrible, So they go through a lot of pain. So I was giving them that pain management. And then also they may lose a lot of blood. So I was giving them blood transfusions and all that. So we do that for when it has spread. That's what we call the metastasis. It has spread beyond where it should be. It's confined. And then we should know that the treatment of breast cancer also depends on its stage. I think I mentioned that obviously before. That the stage 1, stage 2, definitely it's going to be treated and cured. You should be fine. Once it spreads beyond the breast issue, stage 3, stage 4, that one we can't really do much about it. It's more palliative care. And it's quite costly too. I think now a few of the things are being carried by the NHIS, but not all are still being carried. So it's quite costly. So I put these pictures there for you to actually see and appreciate the abnormal breast, how it looks like. So you can see that with the breast that is showing on the screen, you can see it's a huge nodule, so it's swollen, okay, and then the breast is flattened. You can see that the discharge is coming out of the breast, okay. This side is actually showing the red in the nipple discharge. So you can see some blood coming out of the nipples. Definitely an abnormal breast. You don't want your breast to look like any of these pictures that is being demonstrated now. If it looks like there's something going on, it's wrong, okay. And then you can see there's the picture to this thing is showing the lump.
Yes.
Okay, so you can see. And the skin color has also changed, okay. Same with this one too. You can see the dimpling and the orange peel appearance, the podarage, and the flattened nipple. So you see the nipple is not pointing outward like it should. It's actually flattened down. Okay. So these are abnormal findings. Your breast should not look like this in any way. If your breast starts to look like this, they know that definitely you may have breast cancer or some breast abnormality is going on. You have to report it to the nearest hospital.
Doc, we have a question from one of our viewers.
Okay, sure.
Miss First Girl. If your skin color is black or dark, what color change is most common in breast cancer?
Okay, so in dark skin, most people think that if you are dark, you're not going to show. But trust me, when you have a bruise, even though you are dark, you can still see it. When you fall down and you have a sore, you can still see it. So your dark skin does not prevent you from actually showing abnormal changes or something. We can see it when you come most. Because I mean, we do with black people most of the time in any case, and we're still able to pick things up. So you see that they usually have a reddened, it looks either reddened or inflamed. Then we can see that there's something obviously going on. So your skin shouldn't matter per se in the diagnosis of breast cancer. Irrespective of your skin color, we can still see whether it's abnormal or not.
Okay. Doc, before you continue with your presentation, you know, when you're talking about the preventive measures and the cures, you were only mentioning orthodox treatment. You know, we have people who believe in herbal medicine, and my mom is a fan of herbal medicine. When you even tell her to go to the hospital, she'll be like, "Ebibidro or Ebibidro, yes, saying, abrofundro." So, what is there any herbal medicine or herbal product that cures breast cancer? And if there are people who are so much into herbal medicine and want to go to the hospital, what advice will you give to them?
Okay, that's also a very good question you have asked. It's very unfortunate that there is currently no herbal medicine that works for breast cancer. And people would spend a lot of money, they'll go to this herbal list, and they'll come back and the breast is even messier than the way it should be. So for now, we haven't noticed or observed any herbal medicine that actually works or manages or treats breast cancer effectively, okay? Most of them are just on the market. They are not even approved, and they are still being sold, but no herbal medicine has been shown to treat or to cure breast cancer in any way. With breast cancer, the only mode of treatment that would help you is the orthodox one. So, I know some herbal drugs can work in certain situations, yes, but in this particular disease, it's not going to help you in any way. So when you have breast cancer, going to the herbal list or going to the prayer camps are not effective. Okay, you definitely need to go to the hospital because we have to operate surgically. We have to give you chemo. You know, those are the only means that. And you actually, when you actually talk to a few survivors, they will tell you, you know, that they tried the herbal routes and it didn't even work. So they have to come back to us. It always happens that way. They go and use their money and then they end up coming back to the hospital.
Okay, so we have a question again from Roots Radio. Please, are body sprays and bras with the metal in them also linked to breast cancer? Okay,
so that's a good question. A lot of people think that when an underwire bra or a hard bra would cause breast cancer. It's just a myth. It's not true. It's false information. Okay, so whatever bra you are wearing, whether it's hard, whether it's soft, whether you want to wear a bra the whole day or not, I mean, it doesn't affect or doesn't cause breast cancer in any way. It's rather creating some discomfort. Usually, you're a bit uncomfortable when you wear the bra for long and those things, or some trauma to the breast, fine, but it doesn't necessarily cause breast cancer. So your bra does not cause breast cancer. and wearing a tight bra, wearing an underwire bra does not cause breast cancer. And then, secondly, as before we spoke about antiperspirants or the deodorants
Yes,
already, so
yes.
that one, I mean, definitely no, doesn't cause breast cancer as well.
So, Doc, before you continue again, I want to find out, when we were talking about symptoms of breast cancer, you made mention that it spreads when it reaches the third or fourth, it spreads to the brain, your
Yeah.
bones, lungs, and all
Yeah.
that. But then I want to find out if it also spreads. Let's say if you are diagnosed with breast cancer on your left breast, does it also spread to the right as well?
Not that it will spread from left to the right per se, but yes, you may have the two breasts being affected at once.
At once.
Yes.
Okay.
Like, actually, those who have very strong, their genes are quite strong, that strong genetic history, you may have the two of them going through something at the same time.
Wow.
Yeah.
Oh, interesting. Interesting. Doc, please, can you continue with the preventive
Sure.
measures for us?
I think I've gone through the preventive. We did a treatment. I think the next one should be about self-care or the
Self-care.
conclusion. Okay.
Right.
Okay, so the conclusion, I've put all those ones there. That herbal medicine does not cure breast cancer. It's not spiritual. And when you actually have breast cancer, it's not a death sentence. People think that when they hear breast cancer, the first thing they think, okay, I'm going to die. You know, it's something scary, it's overwhelming. You know, you're panicking and all that. But no, the other women have had it. They survived and they are doing well. Men have had it, they survived and they are doing well. And if they've gone through it, you can also go through it equally. So don't always label yourself that if you have breast cancer, it's a death sentence. No. And give your chance and fight the battle. Okay? And let's regularly examine ourselves. And a reminder that some breast tissue actually goes towards the armpit area, what we call the axilla. So when you examine your breast, you have to also go up as well and go into the armpit and check for the lymph nodes and all that, okay? Because your breast tissue actually goes there as well. Most people just focus on the breast, they forget about the armpits, but you have to also check the armpits as well. That's what I put that in, okay? And remember that early detection is key, okay? If we detect it early, we can treat you early, and then you can end up coming out of it alive. So the women shouldn't hide it away from their spouses. Don't hide it away from your friends, your family. Some people will just be seeing the doctors on the side without even involving their family because they don't want anybody to know they're going through this thing, you know. But you need to involve people sometimes. At least a few trusted people that you can talk to, because you can't fight this by yourself. You just need a lot of support.
Okay, Doc, before we move, we have a question again from
Okay.
Arab. Please, does the size of breast matter with regards to breast cancer developing?
Okay, that's also another good question. People think that those who have big breasts have a higher chance of getting breast cancer. That's also a myth because the size of a breast doesn't matter at all. We have seen those who have like 2 tiny dots and they still have breast cancer. You know, and I mean, we've also seen those who are like very big that have it. So, I mean, it cuts across. Anyone can be affected. And that's why even men, even though they don't have a lot of breast tissue, they can even get the breast cancer. So you can imagine. So the size of the breast actually doesn't matter at all when it comes to getting breast cancer. Whether it's small or big, once there's breast tissue there, the cells can come.
Wow.
Yeah.
Wow, interesting. So
Yeah.
it doesn't matter the size of your breast?
No, not at all.
Okay.
Not at all.
Doc, please kindly continue with the
Okay.
self-care.
Yes, so with the conclusion, anytime you examine your breast and you detect anything abnormal, please report to the nearby hospital, not keep it to yourself, okay? And then also, like I said, a lot of free, you know, Pink October is like the best time to screen your breast because everything is usually free. At least you get some free screening. You go to Dollar Wood, screen the breast free for you. Go to 37 is free, Rage is free, Kolebu is free. So many hospitals are doing it free. So you have no excuse not to check your breast during the Pink October. You know, and then most people are also doing the half-price mammogram and the half-price scans and all that. So even if the mammogram or a scan before, this is your best chance to do it. Especially during the Pink October month where people have halved their price and all that, you know. Okay. And at least we have to wear some pink or lilac to support those who have been through the experience before. So at least you can put your pink ribbon on, you know, at least. Let the women know that we are supporting them, okay? I know this was impromptu, you couldn't wear your pink ribbon today, but at least subsequently, tomorrow you can get one and just be walking out there. So people know that, okay, at least you have a pink ribbon too. You can get your breast also checked. So the way you get your breast checked, they give you the pink ribbon. So those who don't have one means they haven't checked their breast, and that's why they don't have the ribbon. Because most hospitals, when you go there and then they check with the breast for you, when they give you the ribbon so that people know that you have checked your breast. Okay, so at least make sure that you have the ribbon as well.
Look, please, before you continue again, you said free breast screening.
Screening, yes. The manual one, the one that we examine with the fingers, yeah.
So I have this question. Do you always have to wait till it's October before we do free breast screening?
Well, October is the Breast Cancer Awareness Month, and that is why. But most people still do the free.
Okay.
I please listen, if you walk in and it's June or July, I'll still do the screening for you because I'm a breast cancer advocate, and that is my free, yes. But because October has been tagged as a Breast Cancer Awareness Month, like it's a global thing, it's a national thing. Everyone knows that in October is this period. Most people will actually assign some staff to do that screening within that month, and that is why they focus only in October. But you can still screen it during any part of the year. Just that it can't be it has to be like the bigger hospitals. You can't go to a smaller place. Maybe a tertiary hospital can do the screening for you.
Okay.
So I just put this there just to remind people that instead of like put your pictures on Instagram and those things, and rather Instagramming your boobs, it's better that you actually do the mammogram instead. So that's why I just put this funny thing there just to create some humor that do the mammogram if you're about 40, okay? Rather than putting pictures of your boobs up, at least do the mammogram. It's better than that. Next slide.
And also, before we move to the next slide, I would want to know, for the sake of my viewers,
I think we are done.
all right, if there are resources available for the treatment and then screening of breast cancer.
Resources and the treatment, it depends on where you are, especially with the resources. Because like I said, it's not everyone that will get the mammogram or the scan to do. It really depends on your location as well. I know like those in the north region, they struggle to get mammograms and stuff over there, you know. But I mean, if you're lucky in Accra or you're in Kumasi, the bigger hospitals, they can do the mammogram for you. And a few private hospitals do the mammograms and the scans and all that as well. So that's a major challenge in this part of the world. And the screening is a big issue for us. You know, outside the GP will just call you are due, come for mammogram or come for this. And you just go for it. It's very, very simple. But in Ghana, it's quite expensive. It's pricey. And we're just praying that one day the prices would come down a bit. And then more women will be encouraged to do their mammograms and the scans.
Also, thank you very much. And also to ask, can it reoccur after your treatment?
It's rare, but sometimes it does. Like 1% of the time. It's not so common.
Wow.
Yeah.
So it means after your treatment, you still have to do your checks.
Yes, you start to do your checks.
So
you're not totally free per se. And usually it happens in those who have a very strong genetic history. You know, but if it's not so strong, most of the time it doesn't recur again. Usually those who have a very strong history of it. Some people, they even take out I know people who take out their breast, who take out their womb, everything. They don't want to even have any hormones within them whatsoever. So they'll take the uterus out, the ovaries out, and the whole breast out just to avoid the breast cancer cells from even thinking of coming again.
Wow. Look, lastly, to ask, are there any advancements aside the radiotherapy, chemotherapy? Are there any advancements in treatment when it comes to breast cancer?
Yes, we have hormonal treatments as well, where when we check we do a biopsy. So when we take the breast tissue out, we check and see whether there are a few receptors that can match up what you have, that drugs that can match up what you have on your breast, the receptors that you have. And we can give you treatments based on that. But it's not every tissue or breast cancer tissue that has it. So when we do the biopsy, we can test and check. Are you receptive to this particular medications? And then we can give those ones to you. So we have hormonal therapy, but it's not for everyone. Okay, you have to have receptors for them. So it differs. So once we do the checks, we can tell whether you have these or not, and then we give you the medication. So those are additional things that have come up. And then obviously we have the cosmetic surgery too. Because now when we take the breast off, we can do the implants, we can do the flaps, we can fix a new breast for you. We can put nipples, like fake nipples on and all that. So we have that advancement in technology now where the cosmetic surgery is really helping a lot of women. So at least you don't feel like it's just a flat something. We'll put the implant there for you, or we'll create a breast and put the nipples on, and then you feel like, okay, you're complete once again.
Okay. Look, we have a question from one of our viewers.
Okay, sure.
So, from Ernest Kelson. Please, what is it about the breast that the cancer cells attacks that part most in women?
What is about the
breast that the cancer cells attack that in most in women? Yes.
Well, cancer can occur in every part of the body, But like I said, women, we secrete a hormone that we call estrogen. Okay. And those hormones actually help in the growth of breast cancer cells.
Okay.
Yeah. So, as a woman, whatever I do, I go to secrete that hormone. Like the way men secrete that testosterone, we also secrete our estrogen. So I guess it's just part of the whole dynamics of everything. It's just science. Once that production is there, definitely there'll be some abnormalities or some, like I said, it's a complex thing. Breast cancer is not it's not a simple process because you're having genetics coming in, you have environmental factors coming in, you're having your hormones too playing a role and all that. So it's a very complex something. But it will be seen more in the breast because of the estrogen hormones that make these breast cancer cells grow rapidly than they should. Yeah.
Doctor, it's been a lovely session with you. I've really learned a lot. It's been educative. We would love to take your final comments when it comes to breast cancer and self-image.
Okay. So my take-home message for those who are listening is breast cancer shouldn't be a death sentence for you, okay? When it comes to the self-image, it's a big deal. A lot of people would lose their hair. Somebody will have reduced libido. Their confidence is low and all that because of the chemo and the radiotherapy and the aftermath of it. Okay, but don't be discouraged. You can see a psychologist and have some counseling. You can even join a support group where you have other members like you that you can actually equally interact with and all that. You can have other self-care routines like putting a wig on, putting makeup on, looking good. Just make yourself happy, and then lead a healthier lifestyle. Okay, eat your fruits, more veggies, avoid drinking and smoking, and I think it should be fine.
Okay. Doc, before you leave, we have an interesting question to ask.
Okay, sure.
So we have one of our viewers, which one asks if the breast do grow back after it's been cut off.
Oh no, it doesn't go back. Once it's gone, it's gone. It can't grow back again. No. It's gone. We just take the whole breast out of where it should be. So
where it should be.
Oh yeah, left with is a scar. Yeah, you just have the scars to show that your breast used to be there before, but it doesn't grow back again.
It doesn't grow back.
And that is why we do the cosmetic surgery. We'll try and create breast for you.
Okay. So before we go, finally, one last question. You made mention that there are times that there's an implant when the breast is cut off. And one time I was at the Legon Police Barracks when a lady came to pass by, and she was like, she did this BBL thing, and then she's having side effects.
Okay.
Her breast, sorry to say, got rotten, and there's some kind of a liquid coming out. So with the implant, does it have any side effects? No.
Oh, everything has a side effects in this world, though. Wow. But I mean, and that is why regular health checkups are quite important. Because if it was done by an expert, first of all, you shouldn't have any challenges. The second, when you are doing routine checkups, from time to time, you're going to check, because actually with a silicone one, sometimes the fluid can come out, it can burst and all those things, but you have to be doing your regular checkups. And make sure you're going to a proper cosmetic surgeon, okay, not just anyone at all. That's also quite important. Yes, you should be fine once you are going through the right procedures and the right route.
Wow. Interesting. Thank you very much.
You're welcome.
Thank you very much. All too soon, we've come to the end of this week's edition of Let's Talk About. We hope you've learned something new about breast cancer. We have been joined by Dr. Irajuwa Ahima Nunu. She is a public health physician at Douala Medical Center, Bema Camp. Kindly join us for another thoughtful discussion next week. My name is Kojo Oseapia. I have been your host for today. Thank you. Bye.